Hey, good afternoon, everyone, and welcome to your Colorectal Health and Wellbeing event. Thank you for joining us today. My name is Macmillan, and I'm the Macmillan Health and Wellbeing Coordinator for the South Eastern Trust, and I'm based at the Ulster Hospital. Before we start, for confidentiality reasons, all attendees today will not be visible to other attendees or panel members. Panel members are aware of those who have registered for the event, but cameras and mics are not functional, so we won't be able to see or hear you. You will, however, be able to engage with the event, and I'll explain how you can do this later. So what's today's event about? Well, speaking with patients and their families, we've been told that whenever they've completed a certain amount or finished their treatment, it can be hard to know what happens next or who you can contact. We recognize that this can be a difficult time, and that there is a strong need for information and support, not just about the clinical follow-up, but relating to the broader issues associated with recovery, such as emotions, returning to work, physical activity, and travel, to name a few. So today is our way of coming together to remind and reassure you of all the help and support that remains in the system for you and how you can access that. Today's event will help you learn more about follow-up, what to expect, who to contact, and when to do so. It's also an opportunity to find out about the information and support that's available to you during your recovery or living with a diagnosis. There are a whole range of supports and services out there who can provide guidance and help you to live well with or after cancer. Our service can signpost you to them. You will see on the program that you will shortly be hearing from some of our healthcare professionals. We have pre-recorded these presentations, but our speakers are here for any questions you may have. All questions can be sent using the chat function. This can be found at either the top or the bottom of your screen, depending on what device you're using. You will see 3 dots. Once you select that, you'll be given an option to use the chat feature. Simply type your question in and send it. Questions will only be seen by panel members, and we will answer any questions asked at the end of the event. We understand that everyone's journey is different, but there are common themes which emerge that affect people, such as fatigue, building your strength and stamina, building your self-confidence, dealing with some of the emotional implications of having had a diagnosis. So I think it's very important to recognize that you're not alone if you're experiencing any of the things I've mentioned. But it's also important to note that there's lots of help and support out there. Today is really about taking the chance to review things, seeing if there are any areas of your life that can be improved, helping you take ownership of your recovery and self-care, and starting to put pieces in place that are going to help you live really well. So with that in mind, I'd like to hand over to our first speaker, Ms. Kathy McGee.
Hello, my name is Kathy McGee. I am one of 7 consultant colorectal surgeons in the South Eastern Trust. You can see us all here in a list, and hopefully at least one of those names is familiar. I'm going to talk a little bit about the treatment of bowel cancer and then move on to what happens next. Everyone attending the meeting will have had a different, unique experience of finding out a diagnosis of bowel cancer and making it through your treatment. The most commonly recommended treatment for bowel cancer is surgical removal. So a lot of you will have been through a major surgical procedure, which may have involved the formation of a stoma. Others may have had radiotherapy as the primary treatment, and sometimes this can result in a complete response, meaning that the tumour has been destroyed and surgery may not be necessary, or it can be delayed. After your primary treatment, additional treatment with chemotherapy may have been recommended or discussed with you. There may have been more surgery to reverse a stoma, for example. Some of you might still be waiting for that. And a small number of patients may need referral for the treatment of tumour deposits in the liver or lungs, which can be either removed surgically or ablated, which means that they are destroyed by inserting a wire into the centre of the tumour and applying energy to it. Once the treatment phase is over, there will be a schedule of surveillance, the purpose of which is to monitor your recovery and progress and to identify and manage any side effects of the treatment. We also want to look for any early signs of disease relapse and to detect any new bowel polyps or even tumours at an earlier stage. The side effects of treatment are wide-ranging, and I have just included a selection of the most common things. Please don't hesitate to mention any symptoms or any concerns that you have to your consultant or key worker. Believe me, we have heard most things, and there could be a simple technique or treatment available to help you. Lots of people after bowel surgery will have trouble with looser stool, more frequent movement of the bowels, loss of warning about movement of your bowels, and even leaks. There are lots of things we can do to help you, so please discuss it. When you attend for your surveillance appointment, we will ask you how you are and about some specific symptoms. There may also be a physical examination, but often now we are contacting you by telephone for these reviews. We will check a blood test called CEA, which is a tumour marker and can give us an early warning system for disease relapse before symptoms develop. There will also be planned CT scans at year 1, 2 and 3 after your primary treatment. And the bowel camera test, the colonoscopy, will be done at 1 year and then 5 yearly thereafter. This may be more often if you've had a lot of polyps in the bowel. If you had a rectal cancer that responded to radiotherapy and did not have surgery, you will be in a specific watch and wait programme with extra camera examinations of the tumour site and MRI scans. When are you signed off? Well, routinely, we would sign you off after 5 years if your follow-up has been satisfactory. You may still have camera tests ongoing after that. Some patients may be discharged earlier than that by mutual agreement if no further treatment would be beneficial or if other medical problems become a priority. This is the last slide, and it's just to highlight some of the warning signs or alert symptoms that we would like you to report as early as possible. When you're coming to your appointment, think about these things. Please report them at your appointment, but if it is a long time till your next appointment, please contact your GP or your key worker at the hospital to mention any of these things, because you may need an examination or investigations to be arranged. Thank you for listening, and I will hand you back to the Macmillan team.
Okay, thank you, Kathy, for all the information provided in your presentation. If you do have any questions for Ms. McGee, then please send those through and we'll do our best to answer those at the end. So you will now hear from Sarah Christie, who's one of our clinical nurse specialists, and she'll be giving you some more information about ongoing support.
Hello, my name's Sarah Christie. I'm one of the colorectal nurse specialists here at the Ulster Hospital. You're very welcome today to our colorectal health and wellbeing event. As you can see, I'm one of 6 colorectal nurse specialists. You may well have met me or many of the girls on the team: Martina, Jacqueline, Lisa, Tracy, Angela, who's currently off on maternity leave, and Una Mairead. This is an old picture. We need to get a new one. Hazel, I'm sure some of you may have met Hazel, has now retired, so we need to get a new picture. That's on our to-do list. So today I'm going to be talking a bit about our role within the colorectal service, your follow-up care and how that is planned, and how to access the service. I'll also be talking about your health and wellbeing event today and your holistic needs assessment appointment. So our role is really quite varied. We are down as your key worker. So that means we're a link with all members of the colorectal team. We have advanced clinical knowledge within the area of colorectal cancer, colorectal disease. So we can tell you a lot about your diagnosis, your surgery, what's going to happen, your time in hospital, and your aftercare. We do have good communication skills. We're used to talking to patients, to families, to other professionals. And we have leadership skills working within the multidisciplinary team. And that's a meeting that's held every Wednesday, and your case will have been discussed at least twice whenever you were initially going for your investigations, and your case would have been brought forward and the decision for your treatment was made at that time, and then after your surgery the decision on your aftercare is planned. We're an ongoing point of contact for you before, during and after your treatment. Other than the information that I've mentioned that we're able to give you about your cancer and your diagnosis, we can also give you lots of practical advice, and those patients who have had a stoma will probably avail of plenty of our time whenever you're in hospital and perhaps afterwards. And in addition to all the information, we're here for emotional support, and we can signpost you to those patients who need extra support, and that can often be through the Macmillan team. We are part of your cancer follow-up, and you will see us in the years after your diagnosis in your follow-up clinics, and we provide you with a holistic needs assessment appointment, and many of you may already had that appointment. So as you can see how the cancer follow-up is set up, at the bottom there you can see the multidisciplinary management. So the decision on your treatment and your aftercare is based on that combination of specialties: self-directed aftercare and shared care. So self-directed aftercare is for those patients who have an early cancer and they do not in fact require additional follow-up. So you'll have an initial appointment after your surgery with your consultant. Then you'll have your holistic needs assessment appointment with the nurse specialist around 6 to 12 weeks. Might be a bit later, and then at that time you'll explain that you're being discharged to self-directed aftercare. So we're putting a bit of the onus back onto you and how you can access the service should you have any concerns. But you don't need CT scans and blood tests. However, you still get colonoscopies, and they will continue every 5 years. And we want you to know the alert signs if you have any issues, and I will be talking a bit about those later on. And of course, you're invited today to the Health and Wellbeing Clinic, and the access to the clinic is ongoing. Cancer follow-up. Your cancer follow-up is set by regional guidelines, and generally it's a 5-year follow-up protocol. It's shared with your colorectal surgeon, the oncologist, for those patients who've had chemotherapy and or radiotherapy, and also with the colorectal nurse specialist. Each appointment is a clinical assessment. It's how you're doing. So we want you to tell us how you're feeling, and for you to tell us any issues or concerns that you want to bring and highlight with us at the appointment. In addition to that, we'll carry out a blood test, and it's called CEA, and that's a protein that's released in the bloodstream and is an indication that things are going along well, hopefully. We also order your CT scans, and they're repeated after year 1, 2 and 3, or sooner if there's a new issue arises or you're under the care of the oncologist. We ensure that you have your camera test, your colonoscopy, and that's after year 1, 3, and then again every 5 years thereafter. I know they're not pleasant. We do refer you to other resources if at that appointment it's felt that that is required. These appointments are now both face-to-face and telephone, and we have had to change the way we work in view of COVID, but we do endeavour to see you if there is a new issue. Access the colorectal service. So between your appointments and your scans and camera tests, you may develop new concerns or issues. And unfortunately, as you may have experienced, appointments can fall behind. And unfortunately, this is what has happened in all services due to COVID. But we are happy to discuss any issues or concerns that you have. And if we can't deal with them, it may be a simple issue or a practical issue, or may just simply need to speak to the secretary to find out about your appointment. If not, we may well need to refer you on to other services. But what we do really want to hear about are red flag symptoms. So do you have a new pain or a lump? Is there any unexplained weight loss, a change in your bowel habit or from your stoma output, blood in the bowel motion, or an increase in tiredness? Looking at your holistic needs assessment appointment, as you can see, we're looking at you as a whole and every aspect of your life. The appointment is to attend one of our team, the nurses. You will be sent out a concerns checklist, and this could be done online as well. And that's to prompt you with any new issues or concerns that you have that should be addressed at this clinic. It's an opportunity to discuss your entire cancer journey and how this has impacted on your life and indeed the life of your family and friends. It's meant to be less of a clinical appointment. And again, we're looking at resources that are available to you. Should that be Macmillan? Should that be exercise? Any number of things that we need to address, or even you could be having ongoing problems from the side effects of your chemotherapy. We want to address those unmet needs. Can't guarantee we can resolve all your problems, but we'll certainly want to talk about them. We want this to be some health promotion. So we want to promote a healthy lifestyle. We want you to stay well. Again, looking at exercise, looking at stop smoking clinics, looking at complementary therapies, reducing your alcohol intake. We want to, this is a means of support to you over and above all your clinical appointments, to offer you and your family and carers support. Today's health and wellbeing event, well, hopefully this has tied everything together and it has formed part of your recovery. As I've pointed out, we're looking at promoting healthy lifestyles, and along with that, hopefully we've educated you a bit as well about both your cancer and your ongoing care and follow-up. And the other resources that you'll hear about today that are available. And whilst you've watched this today at home, there are lots of other patients joining in today, and you're not alone. So thank you very much for today. I will be happy, along with my colleague Jacqueline Blair and Miss Kathy McGee, to talk to you after the presentation if you have any issues. Thanks very much. Bye-bye.
Okay, thank you very much, Sarah. It's great to hear about all the support still available from the clinical team. So we'll now be hearing from Helen Murphy, who is a cancer-focused counsellor, and Helen will be talking about being more aware of your emotional well-being at this stage of your journey.
Hello, I'm Helen Murphy, a cancer-focused counsellor. And today I'd like to take some time to explore ways to look after your emotional well-being after a cancer diagnosis. There will be time for questions following the presentation. Cancer Focus provides professional counselling across the province in each of the trusts, as well as providing a range of other support services for cancer patients and their families. These include our Family Support Service, which is for children who have a significant adult with a cancer diagnosis, art therapy, bra fitting, and our free phone nurse line. Details on how to access all of our services are on our website. Our counselling service takes place in a one-to-one, confidential, non-judgmental environment and provides a safe place to address the difficulties resulting from a cancer diagnosis and treatment. Recovering from cancer and its treatments is not just about your physical body healing, but it's also about allowing the healing of your mind, including your emotions. These are some of the typical responses which are often experienced very acutely on diagnosis and during and after treatment. A diagnosis can bring up a lot of uncertainties and questions. Why me? It brings new fears and anxieties about treatment and survival. Worry is normal, but it can take over. A diagnosis can bring low mood and sadness because of how life has changed, and it can be an extremely lonely place to be, as if no one else understands. The physical impact of treatment and surgery can result in self-consciousness and a loss of confidence. It's common to experience anger at the unfairness of the diagnosis, anger at your own body, anger at others, or at God. Any life changes we experience will need a period of adjustment. After a cancer diagnosis and treatment, it may be necessary to adapt to living with and managing a health condition. It's important to find ways to cope with uncertainties about the future. Patients face the challenge of developing a new sense of self, of accepting changes in their body or in their appearance. Patients may experience new sensations such as pain, numbness, fatigue, or the loss of bodily functions. And finding a way to navigate these very difficult changes is central to achieving a good quality of life. Patients may experience times when they feel very vulnerable. At first diagnosis, when there's huge uncertainty about the outcome of treatments. Treatments may mean depending on others for care, bring feelings of helplessness or uselessness. Even when treatment ends, patients may feel particularly vulnerable without the safety net of review appointments and regular monitoring. A recurrence or a poor prognosis often brings more fears and anxieties. There are common psychological symptoms and problems. Worrying is at the top of the list at 72%. Feeling sad is really high as well at 67%. Patients often feel very nervous. Difficulty sleeping is very common. Feeling irritable, maybe as a result of not sleeping, and having difficulty concentrating, and have psychosexual problems. Cancer brings with it numerous losses. The impact on physical and social and emotional well-being, having to depend on others more, loss of identity when who you were before gets lost, in the side effects of medical treatments and hospital appointments, loss of a role or employment, maybe no longer caring for family or no longer at work, loss of self-esteem, loss of trust in our bodies, and loss of life expectancy, and at times loss of expectations about the future. The world can seem unsafe in a way that it never did before. When we experience loss of anything, we have a grief reaction and we mourn those losses. Cancer almost always brings about bodily changes, and these can affect not just how you see yourself physically, but also how you feel about yourself and therefore how you behave. The physical changes can change how we view our bodies, and our body image is connected with how we view ourselves, how we interact with the world, and how we function. Our minds and bodies operate together. Physical changes also have a psychological effect and can lead to anxiety and depression, low self-esteem from not being able to do what you used to do, adjustment problems, maybe struggling to cope with side effects of treatment, social avoidance, perhaps not wanting to cope with people's intrusive questions or gloom and doom attitudes. In extreme cases, there may be psychiatric disorders. Psychosexual problems may also be an issue. Cancer diagnosis and treatment affects the whole person. Our bodies, our minds, and emotions are all linked. Many cancers and all current cancer treatments may cause sexual problems. Estimates show that between 35 and 50% of all cancer patients are affected. These percentages are higher in gynae, colorectal, bladder, prostate, and breast cancer patients. Talking to professionals can be difficult. 72% of patients surveyed said that their sexual relationship was affected by cancer, and 66% of those felt unable to talk to their GP. This can be difficult for the patient and their partner because they may be unsure that the topic is appropriate. It may seem ungrateful or abnormal. It's not something we're used to talking about with professionals, or maybe they don't want to bother the nurse or the doctor. For the professional, it may be that they are personally uncomfortable with the topic, or maybe they don't want to offend, or due to a lack of training or information, or even a lack of time or privacy. And finding a way to overcome the barriers to talking through these difficulties can make a huge difference. Managing stress is important in everyday life in general. This is one definition of stress. Stress occurs when there's an excess of demands over the individual's resources to meet them. If you think of a set of scales with resources on one side and demands on the other, we have a limited amount of resources, and we need a certain amount of stress to be able to meet deadlines or do exams or interviews, driving tests. But when it's prolonged or out of balance, then it becomes problematic. These are some of everyday stresses in general life. And they can range from something like having trouble with the car to going through divorce, money problems, work issues, unemployment. And none of these stop because of a cancer diagnosis. So often the stress that cancer brings is in addition to these everyday stresses. And then there are stressors which are particular to illness. Pain and fatigue are stressful for both the patient and the carer. Trauma, because anything perceived as potentially life-threatening is traumatic. Often the dynamics of close relationships can change. A partner can become a carer, or there can be a lack of communication between partners. Body image and sexual problems we've already touched on. Losses of health, body image, role, job, safety. Fears are also stressful, fears of a recurrence and about what the future holds. And the vulnerability of when treatment ends. It can seem sometimes like being abandoned by all the medical support during treatment and regular appointments. Stress affects us physically, behaviourally, emotionally, and cognitively, and all of these are linked. Stress is exhausting, and tension can cause headaches and aching muscles. The stress hormones can cause digestion problems, a racing heart, and sleep problems, and behaviour is impacted. We may withdraw or increase alcohol or food intake as a way of trying to cope. Our mood is affected, as is our concentration, and our mood can fluctuate between high anxiety and panic or low mood. Lack of sleep can result in irritability and short temper. And then the negative thoughts are also impacted when stress is around. So it's important to find ways to cope in the middle of all these difficulties. A cancer diagnosis is one of the most difficult life experiences anyone can have to deal with and can be overwhelming. It can help to share your feelings. Who do you have that you can openly talk to about your feelings or situation? If you feel you don't have someone, professional help is available through your GP, other health professionals, and cancer charities like Cancer Focus NI. Don't feel that you have to be strong and struggle on alone. Friends and family are important, especially at difficult times. Often patients feel they don't want to burden anyone close, and yet loved ones can feel shut out by a lack of communication. Get good quality information from reliable websites and organisations or from health professions. Keep busy, but not too busy, so that your mind is focused on other things and you're not dwelling on uncertainties. Set achievable and realistic goals. Start with small steps and build on these. Often this can be encouraging as you move forward. Plan rewards when you achieve a goal. Say well done to yourself and be good to yourself. I'm sure you're familiar with how important these are, how important it is to eat and sleep well. Your body heals and is refreshed when you sleep, and also needs healthy nutrition. The advice is to go to bed at the same time every night, get up at the same time, have a bedtime routine where you wind down before going to sleep. Drink sensibly. Overdoing it may bring temporary relief, but it is a depressant and can lower your mood. It can affect your thinking and impact your medication. Be aware of your thoughts and how you speak to yourself. Often we can be harder on ourselves than we would be on anyone else. Ask yourself, would I speak to a loved one like that? Challenge negative thinking. Sometimes writing down the thoughts and looking for the evidence for them can be helpful. Solve problems as they arise and differentiate between what you have control over and what you haven't. Interests and hobbies help increase your confidence and interest and help you to connect with others. Make time for yourself. Chill out and relax. Ways of relaxing can include anything from music, pets, reading, crafts. Find something that suits you. Relaxed breathing is one of the simplest ways to relax your body and your mind. Imagine a balloon in your belly inflating and deflating as you breathe slowly in and out. Learn mindfulness techniques, prayer, yoga. All of these involve ways of meditating, and this helps our minds to slow down and to be more in the present. Be kind to yourself. Encourage rather than criticize yourself. Treat yourself the way you would treat a friend in the same situation. You might be surprised at how different that can be. Many support groups and classes are online at the moment, but they are available through cancer charities and on the internet, and it can be a helpful way to connect with others who have gone through a similar experience. Professional support and help is available to you from the clinical nurse specialists and medical staff, your GP, through counselling, the psycho-oncology service, and from Cancer NI free phone nurse line. Finding ways to live as much as possible in the present may be the best approach, although this is easier said than done. Living in the present moment takes some practice. So maybe start with living today. Ask yourself, what's important to me today? Yesterday has passed, and no one knows what will happen tomorrow. Really, all we have is now, and the more we live in the present, the better. A cancer diagnosis often makes people reflect on their life, reconsider their options, make new priorities, make or create changes, and reconstruct certain aspects of their lives. It's important to remember that cancer does not define you. It's a part of your life, but not your whole life. It may cause you to look differently at yourself and challenge you beyond what you ever thought possible. Thank you for listening.
Okay, thank you, Helen, for giving us a better understanding into the emotional implications of having a cancer diagnosis. If you do feel your emotional well-being has been affected as a result of your diagnosis and you would like to speak to somebody, then please let us know. You'll now be hearing from myself about the Macmillan Health and Wellbeing Service and the wider supports available to you. And this presentation has also been pre-recorded. Hi all. So as you know now, my name is Nar and I'm the Macmillan Health and Wellbeing Coordinator for the South Eastern Trust. And I'm going to give you a bit more information about the Macmillan Health and Wellbeing Service. We're a trust-wide service here for anyone affected by cancer. We know that cancer doesn't just affect the person that's been diagnosed. It affects family, friends, colleagues, anyone who knows and loves and cares for that person. We're based in the Macmillan Information Centre here in the Ulster Hospital. We have an information zone and a drop-in facility, and our service is here to help answer any questions you may have or get you in touch with the right person who can. We offer support not just to people diagnosed with cancer, but to the public and healthcare professionals as well. In our information zone, we hold a wide range of leaflets and booklets. We recognise that it's so important that you have access to reliable, high-quality information, because lots of the information out there from Google or social media can be inaccurate, not relevant to you, and in some cases actually quite frightening. So we hold all of the excellent Macmillan information and information from all of our partner charities. Our information is located in different points throughout the trust area, in each of the hospitals, in libraries, leisure centres and GP surgeries. You will see that familiar green Macmillan branding. We deal with a range of topics such as cancer awareness, living with and beyond, dealing with side effects, practical issues, information for family and carers, and information on local support. We hold the information in a variety of formats, such as large print and easy read, as well as other languages. We want the information to be easily accessible so that we meet all information needs. If there's something in particular you're looking for or need, just let us know through the chat function and we'll get that sorted for you. We understand that no two people will have the same experience, and this will have been and continue to be very personal for you and your family. But we have found that these key areas emerge, and that's where we would want to offer our support and guidance. Our team is part of the wider cancer services team, and we're very much a catch-all, one-stop shop to help you explore all of the supports available to you. It's a very efficient way for you to get support. So if you're finding there's anything you're coming up against or that you want to talk about, we want you to pick the phone up and have a chat with us. There's no deadline to our support, so you can come to us at any time with any questions, thoughts or feelings which may come up, especially as you reflect back on everything. At this stage, in post-treatment, the areas we focus on more would be healthy lifestyle and physical activity, which you'll hear more about in our next two presentations. We also find that we hear about finances and work at this stage, and we offer work support conversations, which includes things like how to talk to your employer about your diagnosis, letting people know their rights at work when they do have a diagnosis, and how to plan a return to work so that it's successful. At this stage again, managing side effects such as fatigue is another area of our support. And we also offer practical support for patients, which includes transport to and from appointments, advice about travel insurance, or even dog walking services. We understand that there are a whole raft of emotional implications that come with a cancer diagnosis. We find that it's not uncommon for people to feel quite emotional when they come through their treatments. Often, it's only at this stage you can stop and start to make sense of what's actually happened and understand what that means for you going forward. And exploring these emotions and feelings is also a very normal part of your recovery and moving forward. It can be a very hard step opening up about how you're feeling, but we do want you to reach out. Our drop-in facility operates on Tuesdays and Thursday afternoons from 2 to 4 and Wednesday mornings from 9:30 to 12 in our new Macmillan unit. We offer a one-to-one appointment, which is staffed by myself and two support workers. Their names are Gemma and Nicole. We have an in-depth awareness of all of these supports and services available to you. There's so many, but we will talk to you, get to know you, and let you know all of the relevant supports available, and we'll signpost you to them or make referrals where necessary. We're very lucky. It's a lovely service to work for because it's a non-clinical setting. We don't have to watch the clock, and we can spend plenty of time with you so you can tell us where you're at and how you're doing in order to tease out those areas that could be improved, putting things in place that are really going to help build you up and live well going forward. If you have any questions, please get in touch using the information on your screen. Thank you. Okay, so I hope you all found that information useful and are more aware of the various supports available to you at this stage in your journey. We're now going to hear from Janet Gabby, who is a physiotherapist in the South Eastern Trust, and Janet will be giving you all more information about physio after cancer treatment.
Good afternoon, and my name's Janet. I'm one of the physiotherapists working here in the hospital. I'd like to chat to you today about physiotherapy after your cancer treatment, give you advice on how you can be more active after your cancer treatment, and just if you're suffering from side effects which are becoming a barrier to exercise and where physiotherapy can help with that. The first slide we're going to look at is just on how to be more active. This could include things like active living, walking to the shops, using the stairs instead of the lift if you can, just trying to add more steps to your day. Recreational activities such as gardening, DIY, dancing, housework, washing the car. This can all count towards your activity levels. Playing with your children, grandchildren. If you enjoy any particular sport such as cycling, bowls, golf, or running. Formal exercise classes such as yoga, Pilates, and Tai Chi. Swimming is excellent if you can swim, and walking. Walking is the type of exercise that sort of is available, for everyone, no matter what your ability. So it's really turning your, adding more steps to your day and turning just everyday activities into active time and just really spending less time sitting. Do you exercise? Well, it'll help to reduce tiredness. It'll help to increase your energy levels. You may not feel this to begin with if you have never exercised before, but after 4 to 6 weeks, if you do exercise on a regular basis, you will find that will improve your energy levels. It'll improve your strength and your flexibility, so you'll be able to do more things that you enjoy. It'll improve your self-confidence. If you set yourself small goals and you're achieving those, that will help your confidence and boost your mood and help to reduce anxiety and depression. And especially if you try to engage activity with friends and family, and the social interaction that comes with that will help to lift your mood. If you're more active during the day, this will help to improve your sleep pattern and also help to manage side effects of treatment such as hot flushes and maintain your bone density and also help with your weight management. Additional benefits then. Research would say if you're more active, this will help to reduce and delay recurrence or a second primary cancer. And it also will lower the risk of developing other health problems such as heart disease, diabetes, and stroke. So what do we need to do? The government guidelines are that we should do 30 minutes or more of moderate activity most days of the week. Now, if you've never exercised before and 30 minutes seems too much, you can break this down into bouts of 10 or 15 minutes. 2 of your sessions in the week should really be focused around building strength in the major muscles in the upper and lower limbs and working on your balance. Don't worry if you don't have any weights or fancy TheraBands at home. You can just fill maybe a small water bottle with sand or stones and use that as a lightweight, or you can just use your own body weight. For example, just sit to stand from a chair, stepping up and down off a step. And so it's really just about active living, adding activity to your daily routine and minimising the amount of time that you're sitting. Level of activity should we be exercising at? And sometimes the Goldilocks principle is something that you should look at. So if you've went for a walk and the next day you don't feel anything, maybe you think, well, I could maybe do a wee bit more the next time. So that's it, you've no soreness, a bit cold, do more the next time. If you've went out for a walk, for example, and the next day you feel a wee bit achy, but the following day that's eased, that's just the right level for you. But if you are doing something and you find you're sore for the rest of the week or for a couple of days, that's really too much. And you know then to do less the next time. And the mistake that some people do make is doing too much too soon. And then they say, oh, I'm too sore, I can't do that. And they give up. What I would say is just say, right, I did too much that time. Next time we'll scale it back a bit. And you want to be doing something that you can do most days of the week. And you can get a consistent pattern of activity. Considerations to think about just after your surgery, especially if you have a stoma, would be hydration. You can get dehydrated more quickly if you have a stoma. Trying to time activity around meals so that your stoma is less active, and perhaps emptying your stoma before you participate in exercise so there's less discomfort with the stoma moving on the abdominal wall. Have a wee think about your posture, your core strength, your abdominal muscles, and your pelvic floor muscles. You want to have those nice and strong to give you stability around your abdomen. Support belts can be useful if you're doing very strenuous activity, and you can ask your colorectal nurses about that. But you can't just wear high-waisted pants or high-waisted trousers whenever you're exercising. Just a wee toolkit to think of. Emer is going to talk to you about the Move More programme, the Macmillan run. Macmillan also have Get Active, Move More booklets and DVDs. You can talk to your clinical nurse specialist or your physiotherapist. The leisure centres also run a 12-week leisure centre pass, and you can get a referral to this scheme via Macmillan Move More programme or via your GP. A lot of us have phones now, which are smartphones that can track your steps. People have smart watches again, or pedometers, and sometimes you can use that as a guide and try and improve your steps then each week. There's also exercise DVDs out there. Macmillan have one, but some of the other voluntary organisations have their own DVDs as well. And you can also have a look on the websites for advice on exercise. The NHS website, the Chartered Society of Physio website have good information on exercise. You can go on to the Northern Ireland Cancer Network website, and if you go on to the Living With and Beyond Cancer section, you can see what's in your local area. And you also can go on Walk NI or the Cycle NI websites and see what local walking and cycling routes are in your area. The last slide that I want to talk about this afternoon is just your treatment side effects slides. Now there's a whole list of side effects here. Now some of these may be applicable to you, some may not. You may have none of these, you may have some of these. And it's just to say, if you are having any of these symptoms that are a barrier to you becoming more active, do ask to be referred to physiotherapists. There's physiotherapists that specialise in these particular areas, and your clinical nurse specialist can refer you if this is a problem for you. So if you have restricted movement in a particular area and muscle weakness in a particular area following your treatment, and that's a barrier to you becoming more active, do ask for a physiotherapy referral for specific exercises and advice for that. If you have particular bone pain that's not well managed, or you're osteoporotic and you're worried about what exercises you can and cannot do, again, do ask to be referred to physiotherapy for advice. If you're suffering from urinary and fecal incontinence, and that's a barrier maybe to exercise or even trying to leave the house, and you've had a chat with your clinical nurse specialist and they feel there isn't a medical management for that problem and it's maybe more physical, the clinical nurse specialist can refer you to the physiotherapy pelvic health team then for advice and exercises for this. If you're suffering from breathlessness or have problems managing your chest secretions, again, do ask to be referred to physio who can give you advice on pacing your breathing through your exercise. If you suffer from peripheral neuropathy, which is numbness and tingling and pain in your hands and feet, and again, if that's a barrier to becoming more active, again, do ask for a physiotherapy referral for information and advice on this. And if you're suffering from fatigue and just general deconditioning, and you just feel so tired that you don't even know where to start, and you just feel that exercise classes and the Move More programme is just a step too soon, say do ask for a referral to physiotherapy that can maybe start you off a little bit more of a gentler programme to improve your confidence, your own self-belief, and then after that point then we can refer you on to Move More. And if you have lymphedema, which is swelling in the arms or legs, and that's not being managed, or you're not known to a lymphedema team, again, do ask to be referred so you can get that treated and get it under control, and that way then it won't be a barrier to you becoming more active and moving around. Thank you for taking the time to listen to me this afternoon. I say, if you feel that you can't engage in physical activity because one of those side effects is holding you back, do ask your clinical nurse specialist, GP or consultant to refer you to physio. If you feel, nope, I'm not having any major issues, I just want to give it a go, I want to be a bit more active, then do engage with the Move More programme, and Emer will go on to talk about that after myself. I say again, thank you for taking the time to listen today.
Okay, thank you, Janet. And linking in with this, we will now hear from Emer Hagen, who's the Move More coordinator based in Bangor. And Emer will be talking to us a little bit more about physical activity and cancer.
Good afternoon, everyone. My name is Emer Hagen, and I am one of the Macmillan Move More coordinators. My job is to look after the physical activity side of your care and recovery. I am one of 11 Move More coordinators throughout Northern Ireland. We have one coordinator in every council area. So you'll have everyone on the call will have access to a Move More coordinator. Our role is to encourage everyone living with and beyond cancer to get active and to stay active. And it might be to get back into an activity that you've done before your diagnosis, or it might be to find a new activity that suits your needs now. We know there's huge benefits from being physically active, both socially and physically. Most importantly, we know that physical activity can help combat some of the side effects of the cancer treatment. Cancer-related fatigue is a massive issue that a lot of patients will talk to us about. That on not being able to shift that massive weight of tiredness off post-treatment and going through treatment. Now, a lot of the research now does show that the more physically active that you can be, the less that fatigue will reduce. There's also great social aspects to getting physically active, getting back outside after 18 months of us all sort of isolating, getting back outside, doing some walking, maybe back joining a group. My role in our Ards and North Down area is to encourage you to get as active as you can. It might not be within a leisure centre, it might be at home, it might be outside with the grandkids or children, but we do offer some Move More classes throughout the borough and across NI. All council areas will offer some different classes. There'll be some outdoor walks, outdoor activities, indoor Pilates classes, circuit-based classes, dance classes, etc. We are really, really conscious that people are maybe a little bit frightened still by coming into the leisure centre environment. But please let me reassure you that all classes are run socially distanced, masks are worn, and we have created a very safe and social environment for everyone to come back to the centres. Now, that might not be for you, and you have an opportunity to have a one-to-one chat with myself or one of the coordinators to discuss what you would like to do and where you would like to do it. And Move More is very patient-centred, okay? So we can talk about activities that, as I said, you used to do, or maybe a new activity that you would like to try. And we can help you build a little plan to get you back feeling fitter, stronger and healthier. We know all adults across Northern Ireland aren't active to the levels that they need to be. The recommended levels is 150 minutes of physical activity throughout the week. And we know only 53% of the population in Northern Ireland can reach those levels. So I'm here just to encourage you, even if you're thinking about getting a little bit more active, even if we could aim to try to do 10 minutes a day of activity, it can be from housework, it can be going for a walk, a cycle, it can be going to the gym. It doesn't have to be something really, really structured that, you know, you think that you have to be in a gym, etc. It can be at home, and we now have online resources through Move More. We have exercise DVDs that you can do at home, but we do also have the classes available and access to local leisure centres, gyms and swims. If you would like to get involved, please contact me on 077 18 19 44 34. I will be available at the end of the talk for any questions or answers. And if you're not from the Ards and North Down area, please still get in touch with myself and I can pass you on into the correct coordinator's details. We are going to show you now a little short video of Move More and all that Move More represents and stands for. Just to make you aware, the video was made prior to COVID. So it was back in the times where there's no social distancing. So don't be alarmed. But it's a good wee flavour of the patient's view of Move More, what the classes look like, etc. And I hope you really enjoy it.
Afternoon, ladies. Everybody fit and well and ready to get active? Excellent. Let's get going. At present, 63,000 people are living with cancer in Northern Ireland. That means that 1 in 2 of us in our lifetime will be affected by cancer. Physical activity is often referred to as a wonder drug. It can help combat the side effects of cancer treatment. It can help reduce the occurrence of long-term health conditions and can also help reduce the chance of the cancer spreading and returning. We also know that physical activity and exercise is safe both during and after most types of cancer treatment.
I was diagnosed with cancer in December 2015 with lymphoma. I was a very keen cyclist, very fit. During my journey I put on quite a substantial lot of weight, from 15 to 23 stone. I got involved with the Move More programme simply because my wife volunteered me. I then went to the class, which I realised I wasn't on my own, and I never looked back.
Move More Northern Ireland helps people living with cancer get active and stay active. Macmillan Cancer Support funds the project, working in partnership with local councils, physical activity providers, health and social care trusts all over Northern Ireland to provide physical activity opportunities for people living with and beyond cancer.
We're burning this morning. Hands and feet together. That's great, okay? We'll just do 2 more and we're back to the march, okay? This one is fun. Sometimes it can be hard to know when to start to build up your fitness after you've received the cancer diagnosis, and that's where our Move More coordinators can help. Our coordinators can provide specialised and tailored support on an individual basis to help you get back to a level of fitness that suits you. Move More is not just about the gym or running marathons. It can be any activity that suits you and you enjoy.
I'm David, and I was diagnosed with a brain tumour just over 2 years ago. We've come here for exercise in the water, which is very pleasant, much better than exercising in the gym, I find. The water supports my weight and really enjoy it.
We have David here in the pool, and David's been swimming with us for about 6 months now. It's really helped his mobility and walking. It's not just about a gym, it's not just about classes, it can be any activity that you enjoy. It's about moving more.
My doctor took me into the test for bowel cancer. I wasn't going to do it, and I'm glad I did. If I hadn't had the operation, I'd be dead now. I've been told that. I enjoy every day. I try and give back as much to Move More, to Macmillan. Friendship is absolutely fantastic with these classes.
Taking the first steps can be daunting, but that's why we're here.
You find your stride will go back further. Right.
We're here to make it easier and to make you feel like yourself again.
This is going to be exercise for the arms. That's it.
I try and make my classes as appealing to lots of people, so I don't want my classes to be boring. I want them to come along and have a range of different activities. So we maybe do a wee bit of Chai Me and to warm up We could maybe do a wee bit of Pilates, exercise to music, even boxercise and different activities. It's going to cater for everybody.
But dancing does not at all feel like exercise because you're concentrating so much on counting and following the steps. But certainly it does raise your heart rate a lot more than the chimey element of the class.
You've been in the house so long by yourself quite a lot, as I was ill. So it is again the social interaction and just meeting people who are similar. It's a good boost to your confidence, really.
I started the classes when I was about halfway through 16 chemotherapies. I continued here whilst I was on radiotherapy as well. For me, I remember a lady saying to me, get out as much as you can when you're going through treatment, when you're feeling well enough, get out, be busy, stay active, and that's very much what I did.
I'm Alison. I am actually a nurse in the breast care unit in the City Hospital. Ironically, I was diagnosed with breast cancer in July. We send a lot of our patients out into the community, and I actually didn't know what all Macmillan did. So, you know, whenever I was invited to come along to this exercise class, I mean, my eyes were opened at how much they support you and get you into exercise, and you know how important it is. Equally, meeting up with all the other people that are in the class.
Those with poles, just put the poles out to the front. Okay, so we're just going to rotate the left leg. Okay, and now the right
Through
leg.
Move More, Macmillan wants every person living with cancer in Northern Ireland to become and remain active. Finding the right activity makes all the difference.
The support network that you have through the hospital or through Macmillan and through the friends that you meet at classes like this, it's that gets you through.
I move better, I sleep better, I eat better, quality of life just generally improved.
Life with cancer is still life. We'll help you to live it.
Okay, thank you, Emma. As Emma said, there's a Move More coordinator in each council area in the South Eastern Trust. So if you want to explore this further, then please let us know. We will now be hearing from Julie Dorian, who is an OT in the South Eastern Trust, and we'll be talking a bit more about fatigue and cancer.
Hello, my name is Julie Dorian and I'm an occupational therapist and I work for the South Eastern Trust in the community. So some of you may have come across occupational therapy, and for those who haven't, the process of occupational therapy is looking at everyday tasks to improve independence and quality of life. By occupations, we mean the ordinary and familiar tasks that we do every day, that we take for granted until we become ill. Cancer, its treatments and the recovery period can affect our daily occupations. And today I am here to talk about cancer-related fatigue, the cause of fatigue, its impact, and most importantly, some practical measures to help continue those activities that are important to you. So have you ever felt like this? I'm sure many of you can relate to this picture. I'm very mindful that you've already sat through a lot of the slides and talks today, and you could be experiencing difficulties with concentrating. I'll discuss some of the impacts of fatigue later, but it can be a very difficult thing to describe in terms of how we feel. And I suppose I just want to ask, have you been able to tell anyone how you felt? There is evidence out there that people often suffer in silence and they don't mention it to their family, to their friends, to their doctor or their healthcare professional. But the evidence says that fatigue can be the most debilitating, disrupting routines and everyday tasks. So what is cancer-related fatigue? Fatigue can sometimes be confused with tiredness, and we would expect that after a busy day, when we feel tired and we go to sleep, that we wake up and we're fine. But cancer-related fatigue is different, and it can be described as an unusual and persistent tiredness. It interferes with our day-to-day functioning, and it is not relieved usually by sleep or rest. It's not proportional to recent activity. I remember one lady describing feeling absolutely exhausted And this was before doing anything, and it was at the beginning of the day. And it can be very subjective, so it's a very individual and unique experience, and everyone will experience fatigue differently. Many assume that fatigue generally accompanies illness and recovery, and as we said, and therefore they don't mention it. But statistically, it states that 70 to 100% of patients are affected by fatigue at some point in their cancer journey. And it's important to know that it is a recognised medical diagnosis. And we will talk a little bit later now about the ways in which we can manage it. So what are the causes of fatigue? You can see in this diagram that fatigue is a very complex system. And it's not only the cancer itself and the cancer treatments, but there are your emotional distress. It might be lack of activity, or it may be problems with sleep. So how does fatigue affect you? For some, you may experience mild symptoms, while others may experience severe symptoms impacting on the areas identified here. So physically, you might lack energy, or you might experience shortness of breath even after a very light activity. You might even struggle to get up on bad days. Cognitively, so those are our thought processes, you might notice that you're slower in terms of your thinking processes. I can remember one lady describing having a foggy brain and really struggled to try and concentrate on reading a book. Emotionally, you might notice that you're more irritable or you're anxious and you feel very frustrated and more stressed. You might lose interest in things that you once enjoyed, and you might feel less motivated, and you may feel sad or depressed. Socially, this might impact on roles and relationships with family and friends. You might feel too exhausted to go out, and you begin to avoid going out and socially interacting with others. Your spiritual well-being may be affected too, and you may question the meaning, purpose, and value of life. And you might even have feelings of hopelessness. So how do we manage our fatigue? So the key to managing fatigue is to recognise that it is a multi-dimensional problem. Therefore, it is most likely to respond to a combination of different approaches via the multi-professional team. So it's important to talk to your doctor, talk to your healthcare professional, talk to your nurse. They can help and try and work out the cause and how to manage your symptoms. It's important to treat any underlying causes, and your doctor can check for any medical problems that can be treated, such as anemia, pain, or depression. The non-pharmacological management of fatigue, and the remainder of this presentation will focus on this. And this is the practical measures of how you can manage your fatigue. So how can we cope with fatigue? So in this picture, you can see a child with a money box. And the idea is very similar to our energy levels. You can see the child putting all the pennies into the money box and saving them up. And when they open that money box, they have to really think very hard on how they're going to spend their money and what they're going to spend their money on. Energy is the same. You have to really think about what you want to use it on. So in order to do this, and you may have already adopted some of these principles of what we call energy conservation, the 3 Ps: planning, prioritizing, and pacing. So planning ahead, and sometimes this can be a challenge in itself, and it does sometimes take a little bit of practice, but some people find it useful to use an activity diary to plan their day and week ahead. Prioritizing. Again, this will be a very individual choice and what's important to you. So what are the things that must be done and what things can wait? And even think about what others can do. And I know it's very easy for me to talk about it, And being a very active and independent person, it can be very difficult to rely and ask for help. One lady I spoke to found it very challenging to delegate tasks to others in her family. She felt that perhaps they might think that they're very lazy, or that she didn't really want to let them down. But when we discussed the challenges that she was facing in terms of her fatigue and her day-to-day management, family were very supportive and wanted to assist. So pacing yourself, by pacing and spreading some of the activities which demand a lot of energy, those we call high energy tasks, we can learn to better manage our days and weeks ahead. You may be familiar with the boom and bust scenario, where you feel that on a particular day you might have quite high energies yourself and your fatigue is well managed. And then what we do is that we tend to cram a lot of high energy tasks in. And what we notice then is that we pay the price in the coming days and you're fit for nothing. So this is why it's important to pace yourself. When we're planning and pacing, remember to slot in rest breaks and also allow yourself extra time and think of ways perhaps in what you can do and something that you can do in a different way. So as an occupational therapist, we can look at ways together to help manage your day and week ahead. And sometimes it's a simple change in an activity or a small aid that can make a big difference. There was one gentleman that I worked with and he had a real passion for cooking, but he recognized that completing every meal in the day and throughout the day was just too demanding. And as an occupational therapist, I provided him with a perching stool in the kitchen, and this allowed him to conserve energy, and he was still able to continue his role. He also delegated some of those preparation tasks to his family, and one family member became his sous chef. And it just allowed him then to continue his passion for cooking. As an occupational therapist, we can keep into a good sleep routine is recommended. Keep into a routine, going to bed and waking up at the same time has its benefits. While you might be tempted to sleep through the day, it can disrupt your sleep at night. There is some evidence that there are benefits to a short nap of around 20 to 30 minutes, but anything longer is not recommended. Exercise, which has already been highlighted, is one of the best ways to managing fatigue. And in fact, some studies show that avoidance of exercise and activity can make your fatigue worse. Your nutritional intake, so fueling the body, has its benefits. And this can be very difficult whenever you're undergoing some treatments and you have nausea or vomiting. But a dietitian can advise you if you have any issues. Stress levels. How can you manage your own stress levels? And this can be something very, very individual. For some, it's relaxation. There's many apps out there that people have found the benefits of. Finding things that are enjoyable and fun activities. Even talking to somebody how you're feeling can help with relieving your stress. Some people enjoy meditation, others complementary therapy. But like I said, it's an individual choice and it's something that you can only decide. So if we just put this all together and we imagine our body as a human battery, if you put a lot of demands on the body, then the energy in the battery will go down and you need to replenish it. So the demands like dealing with stress, family demands, the anxieties of the have-to-dos, household demands, dropping the kids off to school, recovering from illness and return to work. And even that voice in your head, those guilt, the guilt of, oh, you haven't got that done. So we notice that our battery then starts to go down. And what we would recommend is that you don't get to the stage of having a flat battery. So in order to recharge our battery, we need to think consciously of how we're going to supply it. So things like relaxation, having a good diet and nutrition, sleep routine at night, doing fun things you enjoy. It might be something that you've never done before. Exercise and activity. And as we mentioned earlier, the 3 Ps, planning, prioritizing and pacing. And then setting goals. So in order to increase your energy levels, you can set goals, but it's important to be optimistic and yet realistic. And your occupational therapist can help you to do that. Resources available on fatigue. And if you would like further information, you can go on to the Macmillan website, and there is information that can be accessed through booklets, leaflets and audiobooks and recommended apps, or just pick up the phone and give us a ring. I hope that this information has been helpful. Thank you very much.
Okay, thank you very much, Julie. At this point, I'd like to hand over to our final speaker, Fiona Armstrong, who will be giving us more information about eating well after cancer.
Hello everyone, my name's Fiona and I'm one of the health development dietitians here in the Trust, and today I've got a very short presentation on eating well after cancer. This is a group session, so when giving general information, it's really important to note if you've been given specific advice about your diet by a dietitian or a specialist nurse or a doctor, then do please continue to follow that information because it will be specific to you. If you'd like any further advice on a one-to-one basis, then you can ask your specialist nurse or your doctor to send through a referral to the dietitians. Why eat a healthy diet then? So there's growing evidence that if we eat a healthy diet and if we're a healthy weight and are physically active, then you can help to reduce your risk of getting cancer again and help to improve your overall health. There actually isn't enough evidence to make specific recommendations about what people should eat specifically to prevent a certain type of cancer coming back though. So that's why the information I'm going to give is general healthy eating information today. This is probably very familiar to everybody. This is the Eat Well Guide, and the Eat Well Guide divides the foods we eat and drink into 5 main food groups. So we should try and choose a variety of different foods from each of the food groups just to give us all the nutrients that our body needs to stay healthy. You'll see the biggest groups then are our fruit and vegetables and our starchy carbohydrates. We need some protein foods as well, then a smaller amount still of our dairy and alternatives. Very small slice, the very small amount of unsaturated fats then that we would have. And I'm going to go through each of these food groups in turn. So our fruit and vegetables, so we would aim to have at least 5 portions of fruit and veg a day. We'd want to eat a rainbow there because different coloured fruit and veg gives us different vitamins and minerals and antioxidants. Fruit and veg also gives us fibre, which is important too. So try and get a variety of different fruits and veg when you're going for your 5 a day. Doesn't just have to be fresh, it can be frozen, it can be tinned, it can be dried. Try and get that variety in. They're great foods to be taking, and that's public health message that we're really well aware of. In terms of what actually a portion is, I would say very roughly it's what you can hold in your hand. So 1 apple, or if you think about smaller fruits, well, kiwis would be 2 kiwis would be a portion size. It could be some frozen veg, so about 3 heaped tablespoons of frozen veg would count. It could be a small handful of grapes. All of those would be portion sizes. If we're thinking about dried fruit, then it would be slightly smaller at about 1 tablespoon. And we can count smoothies or fruit juices, but just up to a maximum of 150 mils once a day would count as a portion size for those. Our starchy foods then, so these are about 1/3 of our diet, and these are great at giving us energy. So unless you've been advised otherwise, you should try and choose higher fibre options such as wholemeal bread, wheaten bread, breakfast cereals that are labelled as high fibre. We could go for brown rice, wholemeal pasta. Fibre is good because it adds bulk to our diet and makes it more filling, which is helpful if you're trying to manage your weight, trying to lose weight. Fibre also helps us prevent constipation. The soluble fibre that you would find in oats and in pulses can help us control our cholesterol. If you are increasing fibre, I would say just do it very gradually increase your fibre. And if you're increasing fibre, it's really important to make sure you're taking enough fluid. So making sure you're taking 6 to 8 glasses of fluid. And the fluids can be water, tea or coffee, milk, diluted squashes. The one drink that doesn't count as fluid is alcohol. So don't be taking alcohol thinking it's a fluid. I'm going to talk about alcohol in a couple of slides' time. So dairy and alternatives, these are really good source of calcium, which is important for our bone health. And roughly we'll be wanting to have about 3 portions a day. A portion is about a 200ml glass of milk or a small pot of yogurt or a small matchbox size of cheese. Try and go for the reduced fat versions, so your reduced fat cheese or your lower fat yogurts. In terms of your milks, go for the 1% or the skimmed or the semi-skimmed milks there. If you don't like cow's milk, then go for the plant-based milks. So that could be oat milk, it could be rice milk, or it could be the products made from those. Just make sure that it says on the nutrition panel that it's got calcium added into it, that it's fortified with calcium. Beans, pulses, fish, eggs, meat and other proteins. So like you would suggest there, these are good sources of protein. They've also got vitamins and minerals. Beans and lentils are really good alternatives to meat, and those pulses, beans and lentils, because they're low in fat, high in fibre. They're quite cost effective too, and they're a really good store cupboard item to have in your house. So we should definitely consider having those. We would include fish in this food group, so try and have 2 portions of fish a week, one of which you should go for being an oily fish. So oily fish are fish like salmon, or mackerel would be oily fish as well. In terms of our meats then, we should try and choose leaner cuts of meat. So you could go for your poultry, so your chicken, turkey. If you are going for red meat, then go for remove any visible fat from it before cooking. And if you're choosing something like mince, then look for the lower percentage fat that you can see in the shop. Go for the lowest one that you can afford. You can also use cooking methods that would reduce the fat down. So grilling, steaming, baking, microwaving would all be good ways to cook, which are lower in fat rather than frying. Just looking then at our red and processed meats, these are actually foods that we should limit in our diet. So red meat might be our beef, lamb and pork. So it can be part of a healthy diet, but actually eating a lot of red and processed meat potentially puts us at increased risk of bowel cancer. The processed meats then would be meats that have been preserved by smoking, curing, salting or adding preservatives. So that could be sausages, bacon, ham, salami, pâtés. What the advice would be is that if you're taking more than 90 grams a day of cooked weight of red or processed meat, then you should try and cut it down to no more than 70 grams a day, or you could look at it over the course of the week being no more than 500 grams across the week. To give you a bit of an example about what different weights of meat would look like, a slice of ham is about 23 grams and a quarter pounder burger is about 7 to 8 grams, whilst 90 grams would look like about 3 thin cut slices of roast beef or roast lamb or roast pork. Our oils and spreads then, though that I said that those are the smallest slice in our food groups. We need some fat in our diets, but just a very small amount, and it's better to choose the unsaturated spreads just in terms of our heart health. So that will be rapeseed oil, vegetable oils, sunflower oils, olive oils, and the spreads that are made from all of those products. Butter, coconut oil are all high in saturated fats, so I would suggest avoiding those. If you do use them really sparingly. And in fact, all fats are high in calories, so all fats should be limited, so use very, very sparingly. Outside of our Eat Well guide, then you'll see it's not a food group, but these are our foods high in fat and salt and sugar. So our chocolate, our crisps, our buns, our biscuits, all the foods that we love. They're not any extra benefit to us. They don't give us any extra nutrition. So that's really, if we do take them, we should only eat them in small amounts and less often would be the advice that I would give there. Try and limit them as much as possible. What you can do is go for the other food groups if you're trying to think of snacks. So try and think of snacks from your fruit and vegetables, or your starch carbohydrates, or your protein foods, or your dairy foods. Try and think of those 4 food groups as snack foods to pick, and avoid any of the foods that you would find here as a snack, because really we do want to limit these down, because we don't want to be taking high intakes of sugar or fat, particularly saturated fat. High intakes of fat and sugar can increase our calories that we take, and if we take more calories in than we use up in our activity, that's how we can gain weight. Alcohol then, so research shows that drinking alcohol, irrespective of the type, is a cause of cancer, particularly cancers of the mouth, throat, esophagus, bowel, liver and breast. Alcohol is also high in calories, so if you're trying to watch your weight and trying to reduce your weight, then reducing your alcohol intake could be something to think about there. For anybody that does take alcohol, the chief medical officer would suggest that you take no more than 14 units across a week, and you can't save them all up and have them on one day. You want to have some alcohol-free days. Roughly 1 unit would be what you would find in half a pint of beer. In terms of pub measure of spirits in this country, you would find about 1.5 units. So just be mindful about the amount of alcohol you're taking. Being a healthy weight actually helps to reduce the risk of cancer recurrence or developing new cancers. So looking at your waist circumference can be a really helpful way to measure that. So no more than 32 inches for women, no more than 37 inches for men. Try and follow the healthy Eat Well guide principles if you're trying to lose weight and you really just want to look for 1 or 2 pounds a week weight loss. I've got a good website that will go into a lot more information for you that I'm going to show you at the end now. Just then, a couple of other aspects that people think about in terms of maybe they would ask us about cancer and healthy eating and whether they need to think about these things. So superfoods, really, superfoods is a bit of a marketing term and no one food is going to be beneficial. We need to have a balanced diet. A balanced and varied diet, like I've talked about in the Eat Well guide, is what we need to be doing there in terms of our health is beneficial. In terms of sugar, there's no evidence that sugar directly causes cancer or that it directly encourages cancer to grow. But if you think back to the Eat Well guide, in terms of general healthy eating, we should actually try and limit the amount of sugar that we take, because sugar is calories and extra calories then could potentially lead to weight gain. So that's where we should be mindful of our sugar, because it could be leading to weight gain, and it's not part of healthy eating advice then to be taking high amounts of sugar. Vitamins and minerals then, so you should be able to get all the vitamins and minerals that you need from a healthy balanced diet that I've talked about in the Eat Well guide. The one exception to that is vitamin D, because most of our vitamin D is made by our skin being exposed to sunlight, and because of where we are in the world, we don't get very strong sunshine during the winter months. So the Public Health Agency would suggest that we consider taking a vitamin D supplement of 10 micrograms from the start of October until the end of March. And you can speak to your pharmacist about what ones they have in stock that you could buy over the counter there. If you're somebody that doesn't get out very much during the summer months, then then you would need to speak to your pharmacist and get a vitamin D supplement that you could take every day of the year. So you should consider in that case taking one every day of the year, even during the summer. And that would also apply to anybody who covers their skin because of religious reasons too. Just my final slide there is just some websites. So you might want to pause or re-watch a recording again to get a note down of these websites, because you can find lots of different information there. And I've hopefully written a wee bit of an explanation on the slide about the information that you would find there. But thank you very much for listening today. And I know that's been very fast, but hopefully it's been useful for you. And do check out those other websites if you want more information. Thanks very much.
Okay, thank you very much, Fiona. So that is our final presentation today. I'm just going to hand over now to Sarah, who's been keeping an eye on any questions that have come through to panel members. So can I just ask all panel members to turn your cameras on and remain muted until you're answering any questions. Thank you. You're just muted there, Sarah.
Yep. So it's not Jacqueline, as I mentioned earlier, it's myself and Lisa. So yeah, so there's a few questions have come through, and I'm happy to address some that I think maybe I can sort of discuss. Are you okay, Nora, for me to go ahead? Yeah.
Yes.
So first one was the patient mentioned, and this is, I was quite delighted that he did actually, because I didn't make reference to it particularly in my talk, really about the impact of COVID, and he's made reference to the fact that he's never really seen his professionals, you know, their faces, you know, including ourselves and Lisa. And obviously since March that's been the case, and in actual fact sometimes we see yourselves, the patients, at results appointment, and then when you come in to hospital we'll hardly recognize you because we see your whole face. So as I say, this is me, and yeah, it certainly can be a barrier, and it's very hard for us to get around that, certainly in the short term, until things start to change. But yeah, I can appreciate that that's difficult, you know, for building relationships and things with people that you've spent a fair bit of time with. But yeah, hopefully the mask will go sometime soon. But yeah, I certainly do acknowledge that it's not easy just to be sort of focusing on the top of somebody's face, you know. But so yes, and somebody else also mentioned about potentially offering themselves to volunteer with regards life and living with their stoma. So a gentleman who has a colostomy, and indeed, yes, we would be more than happy to refer them to Colostomy UK, and for them to maybe discuss their life and how they manage with their stoma, and sort of pass on some of their experience. Because although we can talk a lot about a stoma, to have that first-hand experience with somebody who's living with it is certainly vital. So so I get in touch with Derek about that. He also mentioned about reversal surgery, and those patients who are amenable for reversal surgery, and unfortunately not everybody is, and that can be depending on the type of stoma, which in turn depends then on the nature of the surgery. To have that reversal, it can be a very reasonably straightforward operation, or it can be another major operation, and all those things are taken into consideration. And then we have COVID to deal with, and the waiting time, and there's lots of factors that have affected patients, you know, prolonged waiting to have the reversal. So I've put your question forward to your consultant, Derek, and hopefully we'll get an appointment for you to have a discussion about that. But yes, certainly reversal surgery, if it's suitable, there is waiting time for that, but certainly it's something that is very important to, you know, as completion of your treatment could be then that you have your stoma reversed. So certainly keep in touch with us, and we're happy to contact your consultant if you're waiting, or you're waiting to hear about it, etc. So I think that, is there anything else? I think there was another few questions from previously, I think, Nora, wasn't there? I think some of those may have been mentioned with regards to fatigue, and maybe some of those issues were addressed at the event here. So, and then somebody also has an issue with regards peripheral neuropathy in their foot. I'm aware about this lady, and it has been quite complicated. So so I'm not sure if she wants to add anything, or anybody wants to make reference to, somebody has mentioned that they've tried many aspects of managing fatigue: diet, sleep, physical exercise, planning day to day, etc., but still suffering with fatigue, even though 10, 11 months post chemotherapy, and they had chemotherapy for 6 months. I know recovery from fatigue varies from person to person, but would love to have more energy and stamina, even if it's just to do the housework.
So just wondering if there's any further advice under the OT section or advice in general.
I can maybe answer that question. I'm Julie, the occupational therapist. So, I know that we talked a wee bit there just about planning and prioritising and pacing, and I'd had sort of a few examples of clients who really struggled with the fatigue. And I think in relation to this question, it was specifically like household chores and tasks. So I found that in experience from people that using a diary can be very helpful. And it can be very difficult to try and plan and prioritise, you know, what's important to you. But your occupational therapist can help maybe breaking down the task and perhaps looking at it in a different way. I know I'd mentioned earlier just about it might be that, you know, a small aid might be just very helpful, maybe like the likes of an ironing task. You know, some people have found, you know, using a perching stool that it helps to conserve their energy and they're able to do that task. I've also found that people just even recording maybe the specifics of household tasks, which ones they find that are high energy tasks, medium energy tasks and low energy tasks, and trying not to clump them all together throughout the day, sort of all those high energy tasks. So try and sort of spread those out. And the importance, I suppose, of taking a rest break as well. So don't be putting a lot of pressure on yourself to try and achieve and do that specific task, you know, and get it all done. And like I said, you know, you could end up having sort of that boom and bust scenario, you know, where you go, right, I'm just going to start from the top of the house and work right down and get it all done. And then you're absolutely wiped and floored really for, you know, the rest of the day, or you know, you notice that over the next couple of days. So even just doing a little bit of that task and then having a rest break and then going back to the task, I find that a lot of people find that helpful. But you can self-refer to occupational therapy, and obviously I said to give us a ring as well, you know, that because as an OT we can help to break down the task, you know, to be able to manage it more better in terms of fatigue. So in relation to the exercise, I'm sorry, Janet Gabby, who was hoping to get on, she's had some technical problems, she's our physiotherapist, but she had suggested that an individual programme or a referral through to the Move More programme could be helpful, just in relation to maybe looking at an individual exercise programme that might be helpful in terms of the fatigue. So I know you'd mentioned there as well about the person just with the peripheral neuropathy as well. Can I also just mention about that again? Janet just mentioned there that the clinical nurse specialist can refer to physiotherapy for a one-to-one referral in terms of physio assessment. Janet hasn't come across the specifics, you know, of the foot movement, but she said as well just that it might be helpful to link in with the GP. Now she said she's not sure, but the GP would advise maybe in relation to the appropriateness of a muscle relaxant, but the GP, I suppose their expertise would, you know, would be helpful in relation to that, but she's not come across that, you know, as such.
Okay, thank you, Julie. There's just another wee question that's come through there. Does everyone who has had bowel cancer get invited to see a Macmillan nurse as a routine appointment? Or does the patient need to request this? Sarah, are you okay to take this one? You're just on mute there again, Sarah, sorry.
Yes, some of our colorectal nursing team come under the remit of Macmillan nurse specialists. So we are employed by Macmillan, but we're colorectal nurse specialists. So I'm not sure if Jim means an appointment to discuss issues around the resources for Macmillan, or if they're making reference to the holistic needs assessment appointment. So I'll maybe confirm that with Jim. As I say, I'm not sure what he means with regards to the Macmillan nurse and what he feels he needs to get from that, whether he's thinking about the clinical side of things or whether he's looking at availing of resources from a more Macmillan side of things. So I'm not sure if Jim wants to answer that, or maybe I can speak to him closely.
Okay, thank you. So Sarah will contact this particular patient and have a chat with him afterwards. Thank you. Okay, so thank you all to all of the presenters on the call today. We've also got our counsellor, Alison Nichol, in the South Eastern Trust, and Miss McGee as well on the call. So I really appreciate you attending today, and thanks to all the presenters. So that's really it for today. We hope the message has been that regardless of what stage you are in your treatment or beyond, that you're not alone. We are all here, and we all want to help and support you. We understand that there may be many implications of having had a cancer diagnosis, that there'll be times where you need reassurances and when you need to talk things through. So please get in touch. We are still here. Your team is still around you. And hopefully today we'll have given you some things to think about. So if you do need any information or have any questions, please get in touch. And thank you for attending today.